So today's periodic acid strip staining. So basics of past staining will be told today. So what is this staining? Periodic acid strip is a specialized histochemical technique used to detect polysaccharides such as glycogen and mucosubstances like glycoproteins, glycolipids, and mucins in tissue sections. The principle of past staining. This reaction occurs in two primary stages. The first stage is oxidation. Periodic acids acts as an oxidizing agent that breaks carbon-to-carbon bonds between the adjacent hydroxyl groups 1,2 glycols, resulting in formation of dihaldehydes. So this is the first step. The second step is color development. These dihaldehydes react with Schiff reagent, a colorless mixture of basic fusion, hydrochloric acid, and sodium metabisulfate. So it is a mixture of basic fusion, hydrochloric acid, and sodium metabisulfate to form insoluble magenta color purplish red complex at the site of carbohydrate molecules. So what is the procedure? So blocks will be there. Paraffin blocks will be there. It is stored there in the archives of the histopathological section of suspected cases. So first, deparaffinization and hydration. The sections are cleared in xylene and pass through graded alcohols to water. Next is oxidation. Treatment with 0.5 to 1% periodic acid for 5 to 10 minutes. The third step is Schiff reaction. Incubation in the Schiff reagent for 15 to 30 minutes. The tissue typically turns light pink. Fourth step. Fourth step is washing, rinsing with lukewarm water for several minutes to develop deep magenta color. Fifth step, counter staining, nuclear often stain with hematoxylin appearing blue, purple, or light green. What are the applications of past staining? So past staining is very rewarding staining because the structures are beautifully revealed. I will show the photographs in the end. So the structures are very nicely revealed, so there will not be any difficulty in the interpretation. So applications of past staining, glycogen detection, used to diagnose glycogen storage diseases in liver and muscle biopsies. Glycogen storage disease in liver and muscle biopsies. Second is fungal identification. Highlight the fungal cell wall. So for MD microbiology, this is the use of past staining. Candida, aspergillus, zygomycosis, Pneumocystis carinii. So all these can be seen in the tissue samples, easily picked up because that magenta color is very attractive color, very beautiful color, which can be easily picked up. Then third application, basement membrane assessment, useful in kidney pathology to visualize glomerular basement membrane thickness in diseases like diabetic nephropathy. In diabetic nephropathy, the thickening of glomerular basement membrane can be revealed. Then cancer diagnosis. It detects neutral mucins in adenocarcinomas. It helps differentiate acute lymphoblastic leukemia from myeloid leukemia. Such lymphoblasts often show coarse block PAS positivity. Then specific diseases essential for diagnosing Whipple's disease, staining the macrophages containing Tropirema whippeli. So this is very beautiful photograph of histopathological section after past staining. The esophageal candidiasis, you can see the epithelial cells, but here there are pseudohyphae forms of uh, Candida albicans. You can see pseudohyphae forms. So this purple magenta color is taken by the fungal stain. Then this is a Whipple's disease in which macrophages containing Tropirema whippeli is seen. So these are the macrophages. These are stained with Tropirema whippeli. Then Aspergillus fumigatus. Here you can see very nicely magenta color dichotomous branching. Dichotomous branching is seen. And then past staining by the zygomycosis. You can see ribbon-shaped non-branching. Means branching is not seen. Thick ribbon-shaped no, branching is very less, and as well as aseptate hyphae are seen. So this is the pneumocystis carinii. You can see foamy cells, foam-like cells, like honeycomb appearance in past staining. So this is about the past staining. Thank you for your patient listening. Thank you.